Amid the strongest ever sanctions imposed on North Korea, the scale of humanitarian aid to the regime has fallen to the lowest level in recent months. South Korea has donated the largest amount to North Korea through international organizations in the world this year, providing a total of $9 million in humanitarian aid. But food shortages and health issues continue to plague the reclusive state. Today, we go in depth on the current status of humanitarian aid to the north with the chairman of the Eugene Bell Foundation, Stephen Linton. It's a pleasure to have you with us.
Diane, it's my pleasure.
The Eugene Bell Foundation has been at the forefront of battling tuberculosis in North Korea for the last 2 decades. Could you first tell us about the foundation's or your visit to North Korea this year? We hear North Korea has been very cooperative.
Yes, we have 12 multi-drug resistant TB treatment centers that we support in the western side of the country. And on every visit, we visit every site and we meet with every patient. And so in that sense, this trip was no different. But there is a growing awareness in North Korea that this is a serious problem. And for that reason, we are finding increasing enthusiasm, not only among government officials, but also among local caregivers, enthusiasm for trying to do more to address what is their most serious public health concern.
Now, thousands of North Koreans die of tuberculosis every year, according to reports. How serious is the situation now?
Well, tuberculosis, and let's look at it from a total point of view. Tuberculosis is the #1 health issue on the Korean Peninsula. South Korea has a tuberculosis challenge. North Korea's is bigger. But fundamentally, if you're a Korean, the biggest threat to your health overall is TB. And that's not changing, unfortunately. The World Health Organization's partner, Global Fund, has been providing medication for regular TB patients. And they treated 130,000 last year. We focus on multi-drug resistant TB and we treat over 1,000 a year. But these numbers are not going down.
So you haven't seen that much of an improvement as the years go by?
No, we treat a lot of patients. And we have a fairly respectable cure rate. But in order to see the rates go down, you have to diagnose and treat patients early before they pass their disease on to someone else. That hasn't happened.
So I guess that is a serious problem. Now, speaking of which, what do you think is the most pressing priority that needs to be addressed in rooting out tuberculosis in North Korea?
It's diagnosis. Years ago, you just made tuberculosis medicine available and you treated everybody and you pretty well could take care of your problem. But TB has been around for a long time, and a lot of the medications that have been used for decades are now no longer as effective because TB has developed a resistance to them. So the first thing you need to do is to find out whether a TB patient can be treated with the 4 regimen that's considered first-line medication, or whether they need special medications because they're resistant to some of those drugs. And so unless you can find out what kind of TB bacillus is affecting a patient early on, you don't know how to treat them. And I think the biggest problem in North Korea is that early diagnosis is not possible, and therefore correct early treatment is not possible.
Now, working-level nuclear talks between North Korea and the U.S. was held in Stockholm, but that ended without a deal. Did the progress, or lack of it for that matter, have an effect on Eugene Bell Foundation's medical support to North Korea? Do the nuclear talks between Pyongyang and Washington influence the foundation's support to North Korea?
One of the biggest challenges today is that governments are often the biggest sponsors of humanitarian aid. When governments fund humanitarian assistance, it's invariably linked to policy. Our funding comes primarily from South Korea, 20% from overseas, mainly from overseas Koreans. And so our program is not linked specifically to policy, which means that we don't have access to large amounts of government funding, but on the other hand, our program is not affected that much when there are serious disagreements over issues like nuclearization or denuclearization and sanctions and that sort of thing. But indirectly, it does affect us. When things don't go well on the diplomatic front, people get discouraged. Sometimes they give less. Sometimes politicians or government people are tempted to make humanitarian support a carrot in a diplomatic negotiating process. But for the most part, we've managed to avoid it.
So there is some kind of an impact, but the impact of nuclear talks or the existing sanctions are not as great as to be concerned. Now, with the fruition of a series of inter-Korean summits last year, with the historic encounter between President Moon Jae-in and North Korean leader Kim Jong-un, hopes were high that inter-Korean exchanges, including the exchanges in the health and medical sector, would get a much-needed boost. But as you know, inter-Korean exchanges remain stalled as of now. But have you seen some kind of a boost in inter-Korean exchanges along the way?
I don't stay on top of that sort of thing, but I haven't seen any. And one of the reasons is that humanitarian assistance, in fact, all North-South contacts are heavily monitored and managed by the government. Therefore, when North-South relations go well, humanitarian aid prospers. But as soon as North-South relations go sour, it often tends to cut off humanitarian aid. Koreans, on the whole, tend to expect the government to play this sort of a central role in humanitarian assistance. And so they're not surprised by it. But from our point of view, because TB is a long-term problem, because it needs a steady, consistent foundation in order to make it effective, this kind of linkage between policy and humanitarian aid is very unproductive.
So consistency is the key in rooting out the tuberculosis. The Eugene Bell Foundation, as well as you, Chairman Linton, you have just stated that tuberculosis is the most serious health issue on the Korean Peninsula. What kind of role is needed from South Korea in fight against the disease?
Well, Diane, that's a good question. It depends on how the South Korean public see their own role vis-a-vis North Korea. In other words, if South Korea is committed to a government-managed humanitarian aid program, obviously it should go forward as it has been for the last 20 years. But we're hoping that there is a growing awareness within the public that perhaps leaving something like tuberculosis solely to government may not be the answer. Certainly it doesn't appear to be the answer today. And so we're hoping that the government, and perhaps in partnership with the private sector, will start creating long-term programs. And that's one of the most discouraging things about this work, is that over the last 2 decades, that just hasn't happened.
So a government's role is also important, but expanding the cooperation between civil organizations is also as important. Now, what is the Foundation's future plans?
We are constantly experimenting with treatment models that are designed in cooperation with the North Koreans to address their TB problem. We've been doing this for decades, and we've come up with some very interesting ones. And so our next project is to start a community-based early diagnostic and treatment system in 20 county towns or districts, city districts, to just test to see if this can in fact work. If it does work, it could be a model for scaling up tuberculosis treatment all over the country. But it's going to take a lot of money to do that. The ROK government just renovated one TB hospital for about $50 million. And when you think of the relative size of the problem in North Korea, you have to believe that it's going to cost a lot of money. And the big question is whether the Korean people have the will to get behind a program that works and provide the support that is needed to sustain it while keeping it separate from the other political and security issues that have dominated this peninsula for the last 70 years.
So once again, consistency is important regardless of the political situation on the Korean Peninsula. Now, since we have a bit of a time left, what was the one thing that struck you the most? You've mentioned that you visited North Korea twice this year alone. What was the thing that struck you the most in North Korea with regards to battling tuberculosis or anything in general?
Well, after having made more than 80 trips over 40 years, I'm not often surprised at something that I see, but I am encouraged by progress. And we've been trying to make diagnostic equipment. It's called a gene expert. It's a very expensive piece of machinery available on the local level so that our delegations don't have to do all the diagnosing, that we can leave this to North Korean caregivers. And what encouraged me the most on this trip was to see the enthusiasm that local caregivers have for using sophisticated equipment to diagnose patients in their areas. And so when I saw that, we have been doing a little piloting on this project for the last few visits. I think I saw the end. After decades and decades, I think we now have an effective model to make TB diagnosis, early and effective at the local level, and then it's a matter of treating the patients. And I hope I'm right. I'm hoping that in the not too distant future, we're starting with 20 centers. We only have 190 to go. But if we can make it work in 20, hopefully we can find the funding to create an early diagnosis system that will cover the entire country. And when that happens, we will start to see TB patient numbers drop. But until that happens, I don't expect to see a lot of improvement.
One last question for you. You've mentioned that the most pressing priority is early diagnosis, but what other remaining challenges are there in rooting out tuberculosis in North Korea? Perhaps some requests to the North Korean government?
Well, I think the North Korean government is giving us a considerable amount of cooperation. They provide the health caregivers. We don't pay any salaries in North Korea. They provide facilities. Some of them are not very good, but they're made available. And they provide us an unusual amount of access to patients and to medical institutions. So I think under the circumstances, with all the tensions that you mentioned in your opening, I think they're doing the best they can. Now it's up. It's up for the world community, but especially to the Republic of Korea, to start getting behind a program that doesn't just treat people who have TB and know they're dying and come to a center as their last hope for treatment after they've already infected dozens of other people, but to get behind a program that reaches out into the community, identifies TB sufferers early, treats them early, and starts putting this horrible disease behind us.
All right, thank you, Mr. Linton, for your perspectives tonight.
Thank you very much, Diane.